is all
Yeah, that's what I'm about to go over here and hit escape, and I'll start it over. Sit over here.
On my mother-in-law.
Sit over here. Escape. And there she is. I'm nervous now. Let's turn it down a little bit and go.
I am Dr. Travis Holloway, podiatrist. I do foot and ankle surgery. I went to school at Penn State University, College of Podiatrics in Cleveland, Ohio. We have 6 daughters now, and we wanted to find a close-knit community where we could raise our kids and really have those small-town family values. So when people come to see me in my office, I want to try to recreate that sort of atmosphere with values and that feeling of family and home. A lot of the surgery that I do is for diabetic foot infections. There are a number of elective surgeries, including bunions and hammer toes, taking care of surgery for plantar fasciitis, other bone spurs, neuromas. So every time I start discussing surgery with a patient, one of the first questions they ask is, where is the surgery going to be? And I only work here at Cmmc Memorial. I'm a Wilson County resident. This is the only place. I never go to San Antonio. So when I tell them their surgery is going to be right here in the hospital, it's a big relief for them. You don't have to drive to San Antonio. And I think it's a great blessing and benefit to everyone here in Wilson County and the surrounding areas to be able to have these type of specialized surgical services right here in their hometown. The operating rooms are very large, they're well lit, they're clean, it feels great. Going into an atmosphere like that and being able to do surgery and as a patient to have surgery done in that type of environment. The staff here has been phenomenal with every one of my patients. The patient comes first. They treat you like family, they know what they're doing, and they take really good care of the patients. So one of my goals as a podiatrist here at Cmmc Memorial is to help Cmmc build and maintain a good reputation in the community so that it will be the first choice when it comes to having surgery on the foot and ankle or on anything else. People need to know how good this hospital is and the services that we can offer.
18. I'm sorry, it's kind of coming a pattern with me, or pediatrician to.
Right.
Wait till next year. But I have to tell you, these two that have come on are in Wilson. They're wonderful. They're a part of the community. His wife is participating in line dancing, and
Oh my
I go
goodness.
into everything.
When does she have time with 6?
I don't know. Please do not ask me how she does it, but she does it, and she is wonderful. She goes to all the events with us. This is a huge.
I was going to say, with 6 daughters, does he play the well?
Yeah.
So
In the car with
They have a
Where did they
15-passenger
buy
van, right?
It's right there, you need the first one on the left.
oh, the new one?
Mhm.
Oh, okay.
Chris
Chris Pipe,
Uh-huh.
yeah.
He and his,
How do they fit, those houses aren't that big. How do you-
this is a nice house.
Is it pretty
Nice
big?
house.
but great addition. Been trucking along.
Yeah, he's.
We've done more podiatry surgeries here than ever before, so it's been a great asset to us.
Seeing a lot of patients?
He actually can see more. We're having limited area for him to see patients because before the build out, it was very difficult. Even with having, it was him, PVA, Dr. Profena, Dr. Kella, and so now we're opening up, getting bigger, we're gonna have room, he's gonna have more hours in the day to see people, so we've actually, him and I've met, gone over the financials with him, so he understands, making sure his growth is on target, so that, with his contract, we wanna make sure he succeeds here, and that he wants to stay here, so just all in it to win it.
I know. It went away.
So, we've really enjoyed it, and enjoy him being here, and we want him to be here long term.
I hope that he will be. $6, I guess they wanted per school district, didn't they? Good. It's excellent.
So in some of this, we can't forget our physicians, our other physicians. We're marketing all the others. We're working on the growth still with HBO and wound care with Dr. Profena. Again, we've partnered with a new vascular group or vascular surgeon, Dr. Ochoa, right across the street, and getting some of the message out there too for our general surgeon and our podiatrist. And in this case, we did have a gentleman that came through that agreed that he was just so happy that Dr. Fenn and Dr. Moorhead saved his leg. He came in with a big wound, and we're getting this message. It should be coming out in the Phelps insert if it hasn't already. I think so. Yes. So we're great marketing tool there to see our growth. And then Wilson County News Spring Sports Guide for our general surgeon and for our orthopedic surgeon, Dr. Krause. Wilson County News Stock Show advertisements, some of the things we've been doing. Post yearbook ad, put it in there too. New movers, so we're kind of expanding our horizons a little bit just to make sure we weren't encompassing part of Wilson County. Yes, it will encompass, so when somebody moves to our area, they get a special bulletin that comes out and tells them about Conley Memorial and all the services we have. And we noticed we were missing part of Wilson County, so we've expanded that service to added zip codes there, 78112 and 78223. But that'll encompass a little bit more. And this is the layout of some of our new mover artwork that we have going on through them and our surgical services. This is the official layout. Just all of our awards we won over the last year, our clinic system, our outpatient infusion center, because we're trying to grow that too as well. Home health agency, rehabilitation, again, the 3 for now, and we can change this around to what we want growth, but getting that message out to all those people moving to the community is important to us. So the marketing team's been working on that. So they get a list of everyone who gets a new magazine subscription when they move, or they bought a home, and so they send these members out to them. Consulate, if you hadn't heard, they just, with everything going on, they postponed their golf tournament from April 4th to June 13th, and so they've rescheduled that. They've acquired Ancira as a major sponsor. They've donated quite a bit of money to sponsor all 3 of our events, so that was a great thing. ConocoPhillips has gotten involved too as well, and the BEA, so it is doing really good. That's our marketing update.
All right. Next up is the CEO report.
MOB build out, doing great. Most of the main areas have been built out. Our flooring's been laid out, walls, texture, vinyl. We just got in all of our furniture. We have it in Vincent's office, old office, and we're looking at making sure that we've gotten everything tagged and fixed, doing basically a walkthrough of areas that they have to fix. We did adjust, if y'all remember correctly, part of the foundation issues was water underneath the foundation. For some of you who've been here a while, we actually moved the water drainage out a little bit further out into I call it the football field, but it's just the area between, so it's not going back underneath the foundation. So a lot of little things that we've done to improve that area, and so that should be coming by the end of the month. That MOB build out, when you say, Carl, probably all the little tag items by the end of the month, by April, and then we should start seeing us move physicians back to the main campus here. So a lot of y'all brought to me over the time, I've actually handled a lot of billing issues over the last year, and I told you that is one of our last areas to work on. I want to brag on the team. I've really gotten them focused on that area. Kyle has actually looked at it. A lot of people get a simple bill. You owe $50 to Conley Memorial. It comes in an envelope, it's not marked, there's no, it doesn't say who it's from. When you open it up, it doesn't really explain anything. If you have a question about your bill, it's like in small print. So we've worked with our vendor for doing, to collect for collections or for billing, and they're reworking our letters We feel that at current, there's only 2 attempts before you do get sent to collections. We're gonna go to a 3rd attempt. We're marking those envelopes appropriately, giving a little bit more information, and that's just because you have directed me some people with some billing issues, and you've also directed me that sometimes we like a little bit more information to understand on that. So really kudos to him and working on getting that portion done. And then one of the other things in our clinic billing office is just like the referral department, just like the scheduling department, just like the OR department, it was all tracked manually. We are automating it. And so Olivia, Brandon, Kyle, Mandy, they're really working on it for the business office for the hospital and the clinic billing office for our clinic system. And I now have a dashboard. What are we doing? Who's doing what? And then the next portion to build on this is the denial management, to make sure that that's automated so that we are actually, when an insurance company comes in and says, oh, you forgot to put a date on this, or you forgot this is the wrong doctor, and you put down who the referral was and not the primary care, those things we get, it's all tracked automatically and sent back, and we get that denial management. We have that coming quicker, turnaround time to the insurance companies. But I have tracker boards from everything from charges, payments, adjustments, refunds, current AR, average submission lag. I know how long it's taken them to put it out. We can even track that down to the particular person and see their workflow and efforts. Claim type, total CPTs, types of diagnostics, and payer mix. These are all information that we should have at our fingertips and be able to make sure we get things out in a timely manner. So I'm very proud of the team. We're working on that automation. And that's to help. So we got about 4 phases there. Endeavor's helping us out. The people I mentioned are helping us out. We did pay for a company to come in and look at our processes, and they are actually helping us build it out too as well. Also incorporated the help of ECW. They'll come out and help us. So we've built this ECW, eClinical Works, with our own knowledge, sending a few people to classes. They'll actually come in and help us go even further, and they've looked at what areas we utilize and by what percentage and how we could optimize our services. And so for that nominal fee that we asked for, they're coming in and giving us reports, and by May we should have them coming in and finishing out the build out. And then we can do that. They do it for free, do the optimizing. These are the areas you look at, these are the areas that you could improve, see improvements on. Now they'll always come back and say, we'll fix it for you for a price, but we can look at that and see what we can fix to save money too as well.
When you talk about the billing issue, I guess my experience is the bill that I get is typically not a bill. It's a statement.
It is.
And that's all it says. You owe this much, and you're, you know, by the time I get the statement, I may already be in 30 to 60 range. I'm like, well, what is this for? You know.
And so that's kind of that claims data that we were talking about, how fast we're submitting it. So the faster, we need to submit it fast so that the insurance company comes back and can process that and then tell you what you owe, right? And so
It'd be nice
then we
if
can
it
build.
told me what it was for,
Yes.
and not just say you owe this much.
Yes.
Because what I've got to do now is I got to go back and log into Anthem and go, what, you know.
Well, I would encourage you to do that anyhow.
Yeah.
To see the claim versus what you owe and make sure that those are in agreement. But
Yeah.
I would encourage you to do that. Would you? I mean, to me, that's a good check and balance. But yes.
Well, it is, but it'd be nice if we just had a little something about it, because my wife pays the bills.
Yes.
Okay.
Instead of just saying.
Bill comes in, she's like, going, what's this for? I don't know.
What does it say?
And so that'd be our next step, is to actually get into the details, but ours now shows your gross, what your insurance expected, and then what you owe.
Yeah.
And so the details will be the
Does it
next
have a
page.
visit date on there?
Yes, it'll have a visit date now too as well.
Oh, okay. Well, if it has the visit date, I can go right to it then in Anthem.
Yeah.
So.
And so they're really working hard at getting this to people in the update. I should be getting the final letters here in about another week, and then I'll sign off on them. And that'll be the first stage to the improvement of those letters. And then it's also what we share with them, what information we're pushing to them is what they can use. So we'll look at that too as well, see if we can't have some improvements. But I can't tell you, everybody helping out with this has really made it a much better system, and we'll continue working on that. And please keep sending me, if you have somebody that, I mean, we have our normal process, but if you need me to help with some individual out there in particular that would like to express, not just pay or talk to somebody who is not the person who fixes things, their own person on the front line, you need somebody to talk to, someone, please send them my way, I'd be glad to. Sam sent me a great person, Larry, you sent me someone,
So
Jeff,
I
you
know
had someone
the
too?
guy I sent you,
Yes.
he called and left 2 messages, and there never was a return call. Are we looking at that piece too?
That I did not know, so I will look at that.
Yeah.
Yeah, he didn't tell me, oh,
Well,
that's with
I-
the company that they had called, and we did address that.
Okay.
I apologize.
Yeah, it wasn't here.
It wasn't here.
It was
with the
whatever
company.
number was on that.
And we were able to address that too as well, and so they did.
Because that may have solved a lot of the problems and you not have to.
Right, and we did get some, and we talked frankly, him and I,
Yeah.
and there were some calls made, but I think sometimes you see robocalls and these
Mhm.
numbers happen, so you don't realize you're getting a return call from them. And they leave messages, but not every time, and we talked to them about, you need to leave a message so that they know that we called you back, and not just hang up.
Mhm.
And so that was very important too.
Mhm.
So yes, we did address that too as well.
Okay.
Kind of back, let's see if I can go a little bit further here. Infection control, just kind of an overview there too that I wanted to talk to you about. This committee, I know they gave you the whole spill and everything, and but I am truly proud of them and the efforts they have made in getting out to the community. We've been taking care of questions not only from our own patients, but from the community too as well. I've gone to the county meetings too as well and participated in them with, Judge Jackson has actually called several key players in the area. And so we're meeting on that to look at some of the problems we might have in the community and foresight on that. You're gonna hear as people are out of schools, the kids are out of school, so they're staying at home. So what's some of the things that are happening? The daycares are shutting down. And with the daycare shutting down, now I have nurses and staff, ancillary staff that don't have daycare, and they're gonna be having problems with actually coming to work. These are some of the things we're all talking about, even with the county, the sheriffs, the police department. These are all serious issues that we are trying to address as a county. And so we're having weekly discussions. I have another meeting on Monday with them too as well. Everything's moving at a fast pace, and so we have to adjust on a day-by-day basis.
And not everybody can work from home.
Yeah. Some of them we can, some we can, some of them, it's gonna be difficult. To be honest, we weren't prepared to give everybody a laptop and say go home. And to get everybody a laptop, give them access and remote access is gonna be a time-consuming process. So what we're looking at is shelter in place. Our business office, in the clinic system, they may not be, if you wanna come by and have a question about your bill, it's gonna be a phone call. They may come in and the door's locked and they're not seeing patients, and a polite letter or note on the door. I know I went to go visit a county official over at the library, and I went over there, and the librarians wouldn't open the door to it. It was like, it's so-and-so here, and I'm like, what are you saying? And can I ask you a question? They wouldn't open the door. I said, I'll stand back 6 feet.
Yeah.
Could you open the door? And she cracked it and barely poked her head out. But that's good. That's good. That's what we want. But I think people are, for the most part, I'd say most people are very understanding of these processes, and so very proud of the community on that. There is a lot of information going on social media about this. There is processes if we ever do get a positive. You know, there is a notification process. The physician will need to notify the patient, talk to the patient. We will have to notify DSHS, right? Region 8. We would then notice county officials, and there would be processes to this. And so I just want to let you know, so if you see something on there, and any speculative things on there, I can just tell you right now, we've tested several individuals, none of them have confirmed positive. Those you think might be positive end up negative. Some of those you think would never be positive will end up being positive. So we choose to wait for the final verdict. I think that was the thing that he was talking about with the testing, and you asked how accurate it is. I think the screening process has its issues, but then you go in for the confirmatory, and that's what you should do prudently. You're not here to panic people or scare people. You don't act on the screening. You always act on the confirmatory. So, but we would be forthcoming to all that and through a process. Just to let you know, things are slowing down. I get a daily tracker too of what's going on. They talked about surgical services. We are doing emergency surgeries, and those that are important surgeries, anything that is not done immediately or same day is an elective surgery. I'm sorry?
I said it's a smoker's cough, don't worry.
Okay, that's right. Our Surgeon General has recommended that you not perform elective surgeries, but there are those that you need to do within a day or two to find out a diagnosis. We've met we had a meeting with as many of the surgeons that could come. I think we had about 8 of them come and have open discussions on their plan. And so they're looking at their cases, and those that are they still might be elective, but they are necessary to do in a timely manner. One might be a possible cancer patient, and if you don't act now and you wait 2 or 3 months, that might have a different outcome. There might be, for ENT, he may have to cut deeper and further, and that could change things. Somebody who has respiratory issues and breathing issues, and that could be resolved, and we do have a virus out there that can affect breathing, then that might actually be something to improve for them during this time. GI, you may have somebody that is a slow bleed, and he needs to perform something so that he or she does not have to get blood on a regular basis. So we're looking at each of those cases on a case-by-case basis, and we're meeting on a weekly basis, and to make sure that we have, as the Surgeon General said, we're looking at supplies and PPE, and do you have enough rooms available? That's why they've recommended that you go down on elective surgeries. So we're looking at all those things and making sure that we have a plan and course of action as they've asked us to do.
What if the patient says, I want this right now, I want to go ahead and do this?
And it's elective, and it truly is elective,
Yeah.
then we're not putting you at risk. That is a conversation between the surgeon and their patient, so, yeah.
Okay.
So, but I think you're gonna find at many of the places, University is the one that has just canceled all elective surgeries. I believe that's the one. I know Methodist had picked it up for a while, but even they are slowing down. I know most orthopedics surgeries throughout the area that I know of have gone to next to none. So
Like Hassan, colonoscopy is elective. It's preventative. Is that gonna come to a screeching halt?
So, you know what I'm prepared for? This is why we have the cash on hand we have for just such an event. And so, this is something that we are looking at, and you will see it, you will see it dwindle.
Well, it is, I guess we had some wisdom in building up all that cash on hand. I don't think any of us anticipated exactly this, but, it was always there for something. I'm glad we have it.
More than any other business
What
in the
about-
United States.
I know.
What about blood? I hear that there's a shortage of blood.
There is a huge shortage. People don't want to congregate. They don't
Right.
want to go give blood. If I would encourage you, that is the one thing that if you can do, and South Texas Blood and Tissue Center is working on ways to keep people separated and apart and have a cleaning procedure in between. They are in dire need, because there are still emergency surgeries, and we're going into the 99 days of critical summer in just a couple of months.
And Friday, Saturday, Sunday at the Alamo Dome, they're doing
A blood drive?
blood drive by appointment only, and they have them spread out, it's like 10 feet apart,
And so I would encourage anybody that is able to do that, because there will still be emergent surgeries. There will be
And accidents and everything
accidents, the
else.
whole works.
And especially if you have regardless if it's
negative?
positive or negative, it doesn't matter.
So believe it or not, one of the main sources, one of the good sources for them too, as well as the high schools. So, and that is gone
Yeah.
too. And so we haven't seen that shortage here. They've been able to maintain our stock. And I think they're maintaining stocks throughout, but it's a critical need. They don't
The
normally
the rolling effects of this are just so far reaching. There's things that we don't even think about that are at some point gonna get impacted.
You're very right. There are many more things that we've even considered as the county too as well.
There's a lot of rural hospitals that don't have the financial means that we have.
I,
Is this gonna have a huge impact, do you think?
I believe it is. I've seen it in groups and I've talked to a few, and they're very, if this goes more than a couple months, they're financially impacted.
Yeah.
So from the two I've talked to, some of the other ones, some have not as much cash on hand as we do, but
They can weather the storm.
they can weather a few months of the storm, you know.
Some businesses are reacting by laying off people. I'm assuming that's not in our plan.
Not at this time. But there will come a time when we do have to look at each thing, we'll have to look at this on a daily, weekly, monthly basis and make decisions. And they're gonna be hard decisions. Yeah, if this were to roll through, I'm working on plans, Kyle and I love working with Kyle because we'll go through scenarios and we're working on those scenarios. Once if this goes through May, not a problem. You know, there's some things that impact, and we'll discuss some of those things. If this rolls through August or September, this will have a huge impact. So, and we're rolling through those scenarios, and I'll be happy to share you some of those scenarios next month or have some sort of display.
Yep. Well, it's good to be prepared, no sense in being doomsayers.
No, but I am very proud of the team. I mean, Carl and I were talking today, and he's like, let the team know you've got this. Conley always has this, and we were discussing it. So we had Sutherland Springs. We did really great with Sutherland Springs. We did great when swine flu came through. We did good when, I'm sorry? Tornado ripped through. We all came together as a team, and we had no power here.
Also, the biggest hardship was the power.
Oh man, that power, and we all pulled together as a team. People were sweeping, mopping, because the humidity level.
There was a generator issue too.
Yep, well, we always had, the generator we had worked, but the design of this hospital is for the one generator. But you know what happened? Strat came through, Marathon Oil came through. We had 2 generators here. We were all out there in our boots hooking up 2 generators. You know, we had power running to our OR and getting the air conditioners all online, and it was just, it was great seeing companies come together and people come together. And I think this is one of those slow rolling things. If it's fast, if a tornado hits and crisis happens, everybody reacts. This has been a slow rolling thing. You know, we see it coming, what's gonna happen,
Well, we've had a little more time to, you know, I don't wanna use the word prepare, but prepare for plan.
Yes. But then everybody's rolling through all the things that could happen, and so all the fears come to play. And that's where we get out the message. We're having a management meeting tomorrow, again, to go over this. And we're doing it through, I apologize, through video conferencing too as well, so they don't actually have to be here.
Yeah, when it's something fast, everybody reacts. When it's this slow like this, everybody has too much time to think about it.
So, I was hoping to surprise y'all a little bit down the line, but, you know, we've been talking about it for a while. So a few months ago, I had talked to our team, and I said, telemedicine, we've been talking about it for a while. So we've been actually in talks with Olivia and Brandon, team working. We've been working with eClinical Works to provide telehealth. So we had actually loaded it last week, and now everything is coming into fruition. We're seeing the urgency of this. So we have a plan, of course of action to bring on telehealth within our own organization. There's a few little, we could turn it on if we felt the need right this second. We could turn it on right now and just do it. I just like to do things a little bit more prepared, but we're just going to speed up that timeline. And so they've done a testing. We're going out in the next couple of days. By Monday, we'll have some nurse practitioners practice it. We'll also look at some physicians practicing it. And then we're looking at some of the nuances at the billing, on the billing side, and making sure our coders are trained. And we're looking contractually with our physicians too as well. But we hope to roll this out in a very timely manner. It will be through, you know, the first line, as you would call the call center, and they would ask you, what are you here for? What is your appointment for? They would go through the criteria, because there's criteria for telehealth, and if you meet one of those criteria, we'd have some open slots, and our physicians or nurse practitioners would take those slots. So we see this rolling out pretty quickly. I was hoping to surprise y'all by the end of this year, but we're going to be pressed a little faster. So it's gonna be, it's,
And this may just really try the system to where you can work out those kinks even faster.
yes, yes. But,
You know, we can actually bill for it.
yes.
Mhm.
And it can be a video, it can be a chat, it can be just a phone call at this point. The president has actually authorized that too. We could Skype and do this, but the problem with that is then taking that log and putting it into a system. This will have it all here, the time, how long it took. There'll just be data to show, and then anything that they tell you can be logged in vitals and patient results. There'll be allergies at your fingertips if they're an existing patient. You'll be able to see everything in their record, not just taking a phone call and trying to go through it. You'll have their medication summary. Sorry, this was Brandon when they were doing the test, and this is Livy and I on the other side. And we're trying to do this, and but you would have everything pertaining to the patient and their record of their status.
So this is only for existing patients?
No, it could be for future patients,
It
but
could be
most,
Yeah.
yeah, we could do, but the existing patients, are the benefit is having all that knowledge there for you already.
Right.
But everything can be logged in our system. So be expecting this rollout probably pretty soon. It'll have its kinks, you'll hear about it, but we'll work through those. We'll learn from each step. It was going to be a more validated thing coming over the next few months, but I think we are going, as coronavirus, it will come, it's not if, it's when it's gonna hit here. And I think this is gonna become more and more reality. So yesterday, we had 75 cancellations of appointments because of the fear. People not wanting to come out, even though we have processes and waiting in the car and getting you through. And I completely understand those fears. And so that's okay. So we need to be able to provide some other means for people to communicate with their physician, and I think this would be a great
Oh,
thing.
yeah. So who will they be visiting with? Our current group of physicians and nurse practitioners?
Yes, this will be ours, providing that care.
Okay, that's great. So how are we gonna be able to balance between there's patients in the clinic waiting to be seen, and now there's somebody electronically?
So that's a great question. So there's a couple of different ways you can do this. So right now, with the slowing down of the clinic system, there will be slots available. You can take those slots. It's not, we won't have one of those telehealths where somebody will call up and you can connect with a physician, right? Because they have 1,000 physicians worldwide, they can connect instantaneously. You call through the call center and you are eligible for telehealth, and then we'll say, we have an appointment for you at 11 a.m. Will that be acceptable? You say yes. And then the doctor will actually get what we call a cookie. It'll pop up and say it's time for your telehealth. They could still be doing all their review of records and refills, and then all of a sudden when the person punches on that link and it comes in, it'll pop up, the physician will accept, and then they begin the telehealth session. So we'll start off with certain slot times, and then if it goes really well, I apologize, just one more second, and then if we see it take off really well, in the summertime, a lot of times our urgent care, we have nurse practitioners there, and instead of seeing 20 or 30 a day, 50 a day on some cases this last year, they see 10, 12. So we can have slots for them too as well. So we'll use our nurse practitioners, and if we need to expand nurse practitioners to see that, we will do that. If we expand with primary care physicians coming in too as well, we will look at that too. So that everybody has a certain amount of slots for telehealth. So we will grow it as it grows. We also will look at reimbursement and everything else too as well, and how we handle that. Great. I'm sorry, you had a question, sir?
Yeah, what technology will the consumer need to have to be able to participate?
So we've tried it on a couple different things. We tried it on Android and it works. We tried it on iPad, it works. We're having a little difficulty with iPhones right now. But we think we can, if you have the app on iPhone, that's the next test we're having actually tomorrow, is the app on your iPhone, Hilo. Remember that one that has it? We believe they said that if you have problems, you can launch it through the Hilo. So we're gonna try Hilo tomorrow. So these are user savvy people that are gonna be using this, or computer savvy. The younger generation might use this more. I apologize, but wait, I'm not that young anymore. I think of myself.
Hey, they sell those things now called grandpads.
Yes,
You know,
yes, they
so
do.
perfect. Grandpads should come with telemedicine on it.
But it can't be phone calls now. So that's something that we're looking at too as well.
So if I just have a landline, then I can call you.
Yeah, now that's been authorized now, I don't know the future, so we'll have to determine that. I think it had to be a video conference before all this, but yes, so I think that'll help us too.
Wow, well, that's great, that's really good news too. That is I think it's something we've thought about for a while, and it's that you're making a much quicker leap into it, and it's timely as far as
Yes.
That's the future.
That's the future. Carl keeps telling me I need to take a breath, but we'll wait for that breath. We're gonna get it going. So,
Cool, great.
so Carl and the team are gonna help me out too with some of the analytics behind, payer. Curtis has been sending us information, Carl's been sending us information to make sure I'm apprised of any issues, so.
We get paid, we'll move all our patients online and not having revenues.
Yeah.
But the doctor's gonna want to get paid.
So then we have to look at those things.
Yeah, I mean, we're also looking at a situation where there's demand beyond what our doctors can handle
Be
anyway.
more efficient.
Yeah, so, if we're able to meet some of that demand this way, that may free up the physical visits a little more, so that's, it just depends on who you can get to go this route. What's the scope of, I guess, of service they offer on this, what can they do for you?
Well, I think that they're prepared to open it up, our government right now, for this pandemic.
Yeah.
Okay, so there'll be a lot more, but before the scope of the services was limited.
I think depending on how it turns out, they've opened it up, if it works well, then they'll continue.
But I
As
mean,
far as, it's primary care based for the most part, when they
Yeah.
don't have to touch you or look too hard at you.
well, but one of the things that always happens every time you go to the primary care doctors, they take your blood pressure, they take your pulse, they take your temperature, and so not being able to do that here, or is there, going to be?
Well, that was one thing that we were working towards, because there's this little button here called trackers.
Yeah.
So that was actually going to give you certain things, so that if you had certain equipment, again, not everybody would have this, but if you had your Apple Watch and it'd give you your pulse, if you did a blood pressure machine that would actually do an upload, it is an actual upload, not you typing it in. Those things, those tracker devices could actually be intertwined with your Hilo app, because it could be uploaded. But we're not going to have that piece at first. But the future will be, because that was one of the things I did online, is have any information that we could obtain from the patient, because that would allow you to do more, as my understanding. In the old way, or when I say old way, just a few weeks ago, beforehand, if you had to get a steroid pack and they saw you, that they could do a steroid pack. If you came in and said you had a UTI and you needed antibiotics, that was not acceptable. So that was the limitation. I think as this virus, they want people staying home, they're going to allow more and more of this. So, but this will be for a period of time, or if it works, that may become the new norm. This may push the country into a whole new
What's
phase.
going to happen on these things, or these things we wear on our wrist now, that's going to be able to do stuff. So,
Yeah, the first thing they may do is say, give us your credit card number,
yeah.
Yeah.
so we can bill you.
Well, Apple Pay works really nice.
Yeah.
So,
I told the story before, we're on Humana, and my wife, since we last met, had sore throat. She got on Humana, they didn't charge us. He gave her antibiotics. He said, let me look at your throat, and she did that. I don't believe there's any way he could see.
Anything.
But she knew what she needed.
Come here,
before she called
Fluffy.
me. I need antibiotics, so anyway.
Well, that's like, I get
So
this.
it's very active now. We had it with United before, now it's Humana.
can I take control of your phone? Let me turn on the light, adjust the camera.
She didn't turn her light on.
Doug,
All right.
all down your throat.
Well, I get this thing like twice a year, where it's like an upper respiratory infection, and I know exactly what it is, and I know exactly what I need.
There'll be an app for it
So-
pretty quick.
I need a steroid pack and, maybe a Z-pack or something.
So I was presented with the timeline this week, and I bumped that up. Olivia said, you told me to validate it and take it slow, and I was like, after I had to change my mind, let's get it online. And she said, That's great. So she gave me a timeline of a couple of weeks to really work it, and I can even bump that timeline up. So we're preparing to service our community and our patients and whatever means we need. So just know your whole team's working on things like
I
that.
guess Savannah's working on introductory pack, introductory blowout for us.
Yes, oh, yes, sir.
Put it out
Yes, sir.
there.
Getting that out.
Beautiful.
So
That's
it's,
great, Bob. Good work.
Fantastic.
So I just have to tell you, you have a great team here. I mean, I'm talking about myself. I'm talking about you really do. We built a great team, and so those guys, you know, you see them in the hallway. Thank them. They're working hard every day, and I can't be. And I'm the lucky one. You know, I get to sit back and watch them work. So. And,
Well, you know, you're letting them utilize their talents, and not all managers do that. So we appreciate that.
Do any of y'all have any questions for me on my C report? I'm leaving out a lot of things. There's just been a lot to digest, and so I wanted to keep it as brief as possible.
Maybe sometime in the future, we could have a little demonstration.
Oh, I'd be glad to do. You know, that's a great idea. Outstanding.
A what?
A demonstration of the
Yes.
Of the system.
not a problem at all.
Well, the interesting thing will be, you know, how many of the patient base out there will technologically get this
And respond to it.
and use it. So we have this thing at church that's really a cool tool that you can, you know, anybody at church can get into it, they can look in the directory, they can do all this stuff, and
Nobody
most of the people
uses
just look at us like, when we talk about it, they go, what? And so nobody uses it.
It's kind of like the call center. I mean, some
It
people it's
becomes
gonna
a
work
lot
real
more
well
convenient
for,
than
and
getting in
others
the
it's
car,
not.
going to the doctor, sitting in the waiting.
But there will be a you know, a group of people that will use this.
Yeah,
There will be another group that,
That will not.
You're not gonna have
those types.
You still have a flip phone in your
But
phone.
if it's a matter of their safety, I think that they'll, and they can stay home and be diagnosed, I think that's gonna be,
Well,
during a pandemic anyway.
there's some things I just.
Well,
don't
so
think it's for.
If they have a brand
like
tag.
the guy down in Tilden,
Right.
he's gotta drive 60 miles to get a doctor.
Right.
It might be easier just to get on the phone and do
And
that.
say, look at this.
So as
He's gotta
generation,
They'll
drive
say,
40
"Come in."
miles to the drugstore.
Yeah, yeah,
as
exactly.
generations change, you have to be prepared, right? So there was a generation that wanted to go in, they wanted to have a conversation with their physician, they wanted to have a relationship with their physician. And then there's those that they just want to get in and out, they don't want to wait, they're all about here now, what are you doing for me now, and let's get it done. There's nothing wrong with that, that's just the way that generation is. So we have to accommodate that. So telehealth may be small at first. I know other physician practices that have been offering telehealth for a while, and they're only booking 1 or 2 a day, okay? So it hasn't gotten to who they serve yet, but we know the future's there. They live and die on their iPhones and and so that's going to come, and the more we prepare now for it and are ready for it, and we grow that part, I think that's important. People weren't used to call centers.
Exactly.
Yeah,
And they're the ones that are
80s,
having the
90s,
problem
you know,
with
a
it.
call center was, no, that was evil, but now people want it, they can click, they can get what, the ease of having one number. Can you imagine trying to remember every number for orthopedics, for pain, for cardiology,
But this is
for, you're
I don't
right.
know anybody's phone number anymore.
Just know the name
Yeah.
But if you just knew 830-393-1400 and you could get
You could-
everything done,
that you wanted.
everything, somebody could direct you and get you where you want. The thing you need to do is get it done timely. They don't need to be on hold. No one wants to be on hold for a long period of time. And so that's the next stage, getting the call center right. The one thing that I really want is, in some of the call centers we're used to is, if you press 1, we'll call you back. You'll keep your place in line, and we'll call you back as soon as an agent comes available. So that will be one of our next steps to look at.
I haven't quite decided if I trust that or not, though.
I've used it at USAA and a couple other
Yeah,
places.
My company does it, I love it.
I love it because
Because you can start working, do other things.
And
also
then they'll
you
call
can-
you, yeah. I use that.
I don't know, I still have this
For
thing,
like
I think
Sears
they're just
and
gonna
things
blow
like
me
that.
off.
They're not gonna call me.
Yeah.
the ones, the big systems that I know that have it, it has worked really well. And well,
And you're not on the phone for 45
Yeah.
minutes listening to television music.
Well, yeah, you know, so if you're
Or
trying
their
to call,
company.
you know,
Yeah.
Sprint or Apple or somebody like that, that is the way to go, because otherwise you're gonna be on there forever.
Forever.
Yeah, and it's very frustrating. So that
You know,
is-
it's been a pleasure. Wilson County News has actually engaged me on several counts on actually what's going on, what do you, just our thoughts and what we're doing here. Judge Jackson, everyone has been very helpful and very open, and these talks have been really good. Your community has really come together, and everybody has a little bit of fear out there, and that's okay. I think healthy fear is good, but then moving forward, I think knowledge is the best power that we can give, and so anything we can do, we want to thank every one of them, and we appreciate everything y'all do and getting it out. So if you hear anything, or we need to follow up with someone that I haven't followed up with, let me know. We'd be glad to do that. I know Sue loves this. This is the thing she loves to do.
Does.
And I love that Sue loves to do this. So she is great. And so.
She's always good in a crisis, for
Cheers.
sure.
Cheers. There's a lot of people here. You know, the funny thing, there's a lot of people here
That
that are
do.
great in a crisis. And we're privileged to have them on board with us.
I just want to say, Bob, that I appreciate your willingness to call those people back and do those things, because that means a tremendous amount to them. Like I say, even if you don't give them the answer they want to hear sometimes, at least you're talking to them, you're diffusing any future hostility or whatever it might be, and that's a tremendous thing in this community. I've had several tell me, I was surprised, he called me back, you know, and that's a good thing.
And willingly.
Yeah.
You were.
All right, well, that's all I have.
Okay, we will now, next up is executive session of the Board of